Hello, so today I'm going to go over cranial nerve, neuro assessment, and dermatomes and myotomes for sideline assessment for football or any other sport. First, we're going to go over the 12 cranial nerves. Starting off with the first one, cranial nerve, testing olfactory, which is smell. I'm just going to smell this icy hot. You smell that? All right, so that is good. Means the cranial nerve 1 is good. So next, we're going to do cranial nerve number 2, which is test the optic. Could you place a hand over one eye and then read that sign? Just the top of it.
Yeah. Resistance, tubes, and bands.
Yep, perfect. All right. So visual acuity is good there. Next, we're going for number 3, which is oculomotor. And I'm going to use my pen light here and just go over the pearls. First, we're going to go gonna check the dilation and constriction. So just start right here. And then, all right, that's good. Compare bilaterally. All right, then I'll check one while doing the other to make sure they're both good. All right, perfect. Good. All right. And then also going in H pattern. Actually, hold up. Just follow it. Don't move your head. Just follow it with your eyes. Right, good. All right, perfect. Next, going with well, kind of did it. Number 4 is kind of the same. Just making sure they can follow all the way down with their eyes. Now we're going to test cranial nerve number 5, which is trigeminal. So you can just like move your jaw like you're chewing on something. All right, awesome. That's perfect. Number 6, we're going to go abducens, is another eye movement. We're just going to see laterally, just follow it laterally. Right, good. Next is 7, it's the facial nerve, so just make a face and smile there. Perfect. All right. Next, number 8, this is going to test hearing. So I'm just going to rub my fingers together and tell me which side you hear on. All right. All right, good. So both are working there. That was number 8, the vestibulocochlear nerve. Number 9 is a glossopharyngeal nerve. So just say ah. All right, good. No evil movement, and then you can also test the gag reflex with that one. After that, we go with number 10, which is vagus. Not like Las Vegas, but Vegas, V-A-G-U-S. Can you say something?
Same words.
All right, perfect. That works. All right. And then let's see. Next is the accessory. I'm just having you shrug your shoulders. That's cranial nerve number 11. Good. And then last and not least, cranial nerve number 12, which is hypoglossal. Just have you move your tongue side to side. All right, perfect. Awesome. So those are the cranial nerves. Next, we're going to go through the myotomes for C1 all the way through S2. So first, I'm just going to have you, I'm going to apply just a little bit of resistance. Going to number 1 and 2. Can you extend back? Good. You flex. Next flexion and extension is good. So C1, C2. And then for C3, lateral neck flexion, good. All right, awesome. And then C4 will be shoulder elevation. Can you shrug up from it? Awesome. And then next for C5, can you kind of bring your arms out? All right, good. Shoulder abduction. Next is C6. Can you flex? Can you flex your arm like a bicep curl? Awesome. And then next, for C7, can you push down, extend the elbow? Awesome. All right, can you flex your fingers in? Don't let me break them. All right, perfect. That was C8. And then for T1, all right, so I'm gonna have you extend out. Don't let me break. All right, C8 for finger abduction. Next, let's see, that was T1 actually, my bad. All right, so next, I'm going to test L2, and I'm going to have you pick up your knee. Perfect. That's hip flexion. That is for L2. Next, L3. I'm just going to have you extend out. I'm going to hold it. All right, good. That was L3 for testing knee extension of the quads. For L4, I'm going to have you pull your foot up towards you. All right, now let me break. Good. That is L4, testing dorsiflexion. Number 5, I'm going to have you bring your big toe back towards you. Don't let me break it. All right, L5, testing big toe extension. Next, I'm going to test, you put your, like you're pressing down on the gas pedal. All right, don't let me break. Good, that's S1. Then S2, I'm going to have you hold your leg flexed. Don't let me pull you out, all right? Good, that's testing knee flexion of the hamstrings, and you want to compare these bilaterally to make sure there's no differences. Next, going for dermatomes. So we're going to test, I'm just going to make sure that he has feel of different parts of the body. So for C1, C2, can you feel this? All right, C1, C2. Next, C3, you feel here. All right, C4, feel this. All right, C4, and then C5, for that. All right, for C6, base of the thumb, feel that? All right, awesome. C7, middle finger, feel there, all right? And then C8, you can feel that on the lateral side of the pinky, that's C8. And then for T1, feel there, all right? What about for T2? Feel that? All right, awesome. And next we go to the leg. So we got L1, which is in here. Feel that? L2 here. L3. Feel that?
Yep.
All right, and then L4. You feel that? All right, L5. You there? Feel that?
Yep.
All right, S1, side of the foot. You feel that? What about S2?
Yep.
All right, and then S3 and S4. That's for other places that I will not be testing. And that is a neuro assessment, and then dermatomes, myotomes, and cranial nerves. Thank you.